Hi, my name is Tracy Irby, and I'm the director at the Center for Women Entrepreneurs here at TWU. I have been an entrepreneur for 25 plus years, also serve as an adjunct instructor here at TWU, but I did want to talk to you about starting your own business. Um, our center was funded by the state legislature in 2015 to help promote women entrepreneurs anywhere in the state of Texas. And we help through funding, advisement, training, networking, and mentoring opportunities. We also support research here on campus. So many times, and there are many degrees where you're never taught anything about entrepreneurship. And there's so many in medically related fields that end up going and wanting their own business, their own practice, et cetera. So we're kind of going to go over a very fast overview. And if starting a business is anything you want to do, we are here to help you. So many people leave a job in their industry for many different reasons. You could be in an unethical setting. Productivity demands just make no sense. You can't work that many hours they're trying to put in place for you. You don't have proper mentorship. You haven't found your setting, your place, what it is exactly you want to do. You could be getting bored with your interventions and what you're doing on a daily basis. Uh, may not like the setting where it is. Maybe you have to drive down 380 every day. And many times people think the grass is greener on the other side. Well, it's great being able to own your own business. And before you do this, if you're working somewhere and thinking you may want to start a business, now's a great time to get the information out there, start gathering what you need to know. And we recommend that you start with a business plan. We have a business plan template called Live Plan. If you just Googled business plans, B plans comes up, but that's Live Plan. And we pay for 150 seats, so we could get you in at any time if you wanted to start a business plan. And it is so important because it really helps in your decision making. It's great to be figuring all this out while you have a job working for someone else. The business plan can help with communication, analysis. When can I hire another OT or staff members? It's necessary if you're going to get business loans, investments, supplies, etc. Can help you think about your business more clearly before you get started. And it can help you take large tasks and put them into manageable ones. So you'd want to do this before you get your business started. It's very important when you need money, stuff, people. Obviously, you need a lot of equipment for your business, some at least to start with, depending on what type of business it is that you decided you were going to go into. So it's a regular part of your business. It's something you're going to want to update every year. Take a look at it. It's an ongoing process, not something you do once and never do again. Excuse me. So once you have completed your business plan, there are things that you're going to want to think about before you register your business with the state to make it legal. One is you want to name your business. You can think of something unique, catchy, descriptive. You want a name that's not going to limit your business. Make sure the name sounds good when said aloud. Sometimes things don't sound the same when you speak it. You can Google to see if the name is already in use. You want to keep it short because it will be your email. We recommend that you always pay the additional $4 or $5 to get email so your business will sound professional and that you're not sending an email from myfunot@aol.com. So you want to think about all that as you're starting your business. And once you think of a name, Don't be putting it into the site over and over. Let's say you're at GoDaddy and you are looking to buy a name for your business. If you keep searching, around the third or fourth time, your business name will be gone, and then they're going to want about 1,000, 1,500 or more for the name. So be very careful where you put it. You can even just put it in the URL bar rather than doing it on the site where you're going to purchase it. I know this because I made this mistake, and it still makes me mad when I go back and look and see how expensive that domain name would be today to purchase it. You're going to want to determine your business structure. You could be a sole proprietor doing it as a DBA, just you. It could be a general partnership, a limited liability company, or a limited partnership. You may want to start it as a professional limited liability. So there are many different options for you out there. You can check with an accountant and a lawyer when you're doing this as well. You're going to need to get an employer identification number. It's kind of like a social security for your business. And you pay for that. You can apply for that online. It's a free service that's offered by the IRS, and you get that number immediately. You have to think about, would your business need a sales or use tax permit? Typically, services aren't taxed, but you want to go to the state of Texas website to make sure. And maybe you're going to be selling some items. So if you're selling anything tangible, you definitely have to have a sales and use tax permit. Once you have at least two things set up, LLC, EIN, you can go to the bank and set up a business bank account. They usually want two things to identify that you really are a business. So if you had an assumed name filing, a partnership agreement, whatever way you've organized your business, you can take those with you to the bank to start open your first business bank account. You want to think about insurance. And again, this will depend on where you want to go with the business. You want to think about malpractice, health, life, disability insurance, liability insurance, workers' compensation, employee practices liability, disability coverage, employee fidelity bond, business interruption insurance, umbrella policy, all kinds. It's best to meet with a broker that can choose for you from many different companies. Sometimes they're what is called a captive business, and that would be like your State Farm, where they can only sell State Farm products. You want one commercial broker that can choose from many different companies. That way you're getting different rates and not just one. You want to check out all the state and local requirements in your field. Obviously, the Texas Board of Occupational Therapy examiners, you're going to have to pass your exam. Before you do that, there'll be continuing education to keep that going. Texas Health and Human Services, there may be some information for you to look at there. So always thoroughly check the state guidelines for the business that you're going into. If you're going to be taking insurance, you'll want to get a National Provider Identifier, NPI number. It's a unique identification number for covered healthcare providers. It's a 10-position number, so you want to check and get that for your business as well. You're going to want to look into credentialing if you're going to be taking insurance. This provider credentialing is the process that medical organizations verify their credentials of healthcare providers to ensure they have the required licenses, certification, and skills to properly care for patients. This will allow you to accept insurance from Medicare and Medicaid and private insurance. So you want to submit your provider enrollment and credentialing applications. You also have to think about different technology that may be needed. Do you have electronic health records? Are you going to need a practice management software, medical billing, patient experience, intake forms, computers? Is there specialty equipment for your field that you're going to need to get? Interoperability of health data. Today, 36% of medical record administrators have trouble exchanging patient information. So you're going to want to look into that and what different things that you're going to need. There's probably compliance training that you are going to have to know or go by. Could be from the Occupational Safety and Health Administration, OSHA, clinical laboratory improvement amendments. You want to look at this if you're going to be doing any lab testing, etc. That may apply to you. Start compliance. That one allows physicians from referring Medicare patients to other companies that they own as well. So there could be things that come into play for you. HIPAA, the Health Insurance Portability and Accounting Act, you'll definitely need to be familiar with that. You may need to know about things from the Federal Food, Drug, and Cosmetic Act if you have using any medical devices in your practice. You also want PCI compliance. That is for credit cards. If you're receiving those, you're going to need to be PCI compliant as well. Then you get to think about your office administration, sales marketing. How are you going to do that? Are you going to need a human resources person, or are you going to do that at first? Bookkeeping, credit card processing, medical waste, is that something you're going to deal with? And then background check services is very important when you're hiring people. Getting started, there are a lot of different free resources. Our center is here always to help you and guide you through the startup process. There are free websites that you can make. Constant Contact is good for newsletters. How are you going to take payments? Are you ever going to be out? Is your business mobile where you're going to need to take payments on the run? There are several that you can do through your phone as well. Square, PayPal, Stripe, Venmo. There are all kinds of different ways people are accepting cash payments now. Think about bookkeeping, people fund. All of this is just a very broad presentation just to give you an idea of some of the things you may need when you're starting a business. Entrepreneurial opportunities. So there are so many different types of businesses that you could go into. Some of these aren't just for occupational therapists, obviously. Some have gone into things like drug screening, alternative healthcare. Some work at medical health spas. In OT, we have several past grant winners in Accelerate Her, our training programs that have been in there. And one set up a mobile practice that worked very well for her. I have another client, award winner who helps and goes into people's homes to help them from falling and assesses their homes for them. So there are a lot of different things as an OT that you could be doing. There's also an opportunity always to do consulting. You could do this while you're working another job as well. You could be an occupational health consultant. Again, senior consultant. Is it something where you can go in facilities that are already there and assess them for falls and other things and have a business that way? We have another OT client that sells products for the home, safer products like rugs and the things that go underneath them. So really think out, there are a lot of opportunities out there for you. So if there are questions, feel free to reach out to me. at the Center for Women Entrepreneurs, turvey@twu.edu, or you can go to our link tree and look at some of the different things on our website. This will also take you to our YouTube page, where we've created content on there from many of our in-person events in different areas about starting your own business. So I'm so excited for you guys to explore this as an option. Being self-employed can be wonderful. It can give you the time you need. It is hard work, but after you get settled and established, it seems to get easier as you go through the years. So thank you very much for watching this. I thank you and wish you success in whatever it is you do from here. Thank you.